We're live. I can't type for some reason, but go ahead.
Okay. Happy Sabbath and good afternoon. Welcome to our Young Married Couples program. I hope and pray God is keeping you safe and sound. Today's program is a conversation with the doctors on pregnancy, conception, and physiology. Our two guest speakers are professional medical doctors with extensive experience. We got Dr. Pasiguti and Dr. Stacey Pickard. To those joining us for the first time, we have a 30 to 45 minutes presentation from our speakers. This will then be followed up by a questions and answer session. So please write your questions and post them on YouTube and on Facebook tabs. Now we welcome Dr. Stacey Pickard for the opening session, and then will be followed up by Dr. Pasiguti afterwards. Dr. Stacey, it's your time.
Hi, can you see me?
Yes.
You can see me and hear me, okay. Right, I'm just gonna try and share my screen. This one. Right, I don't know if you can see my screen. Are you able to see it? I need someone to let me know.
Yes, we see it now.
You can see it? Okay. All right, so good afternoon, everyone. Just a quick introduction to who I am. I'm Stacey Pickard, as already been said. I qualified in medicine in 2011. I did the compulsory 2 years of general foundation training. And then since 2013, I've been working in obstetrics and gynecology. That's my chosen specialty, and I'm working my way towards consultancy. So I'm currently working as a registrar. I've been asked today to do a little talk. I'm hopefully going to keep it quite short about preparing for pregnancy from the physiological point of view. So in terms of the presentation that I've put together, I thought we'd have a quick chat about pregnancy physiology, about what we can do to optimize your chances of getting pregnant, and also a little bit about when it doesn't go to plan. So, sorry, my presentation stopped. Okay, so why is it important to try and prepare for pregnancy? So this very complicated slide, which we're not going to read, is an attempt to summarize the impact that pregnancy has on the body. So as you can see, pregnancy impacts all bodily systems. So it can often reveal problems that you may have never known that you had, because it places such a stress on your body. If you're already operating from a suboptimal place, pregnancy can be the straw that breaks the camel's back, so to speak. And this is why it's so important to try and prepare your bodies for pregnancy. Now, a lot of you may have heard much about maternal mortality in the news recently. There's been a lot of talk about the moms that have died, and in particular, the inequalities in maternal mortality. This is a summary of the report that everyone's been talking about. It's from a collaboration called Embrace. They are the group of people who collate all the data about maternal deaths in the UK and give us a report every single year looking at a particular triennium. So the report that has just come out is looking at the women who died between 2015 and 2017. Now, while our numbers in the UK of maternal death are low, we never want a baby to be motherless. So we're always trying to improve practice to try and reduce the amount of women who are dying. As you can see, if you look at the image on the left, the most common cause of maternal mortality was heart disease. And this can often present for the first time in pregnancy, as I said, due to the stresses that pregnancy puts on the body. This was followed up by development of blood clots in the legs and the lungs, epilepsy, and then it went on to some other medical issues such as sepsis. If we look at the blown up diagram, this looks at health inequalities in maternal mortality. Black women, as has been widely reported, were 5 times more likely to die during pregnancy and in the immediate period afterwards than white women. Also looking at age, the extremes of age, so teenage mums and mums over the age of 35, but particularly over the age of 40, were also disproportionately more likely to die during pregnancy. And this was due to a number of risk factors. In addition to this, the report also revealed a number of issues that we have influence on, basically. So things that we can do to try and reduce our risks. So when we're looking at the women who died, it showed that 2/3 of them had a pre-existing medical condition, 28% had pre-existing mental health issues, more than 50% of the women were either overweight or obese, and 2/3 did not attend all of their antenatal appointments. So as you can see there, there's a bit of information there, a few clues as to what we can do to try and reduce our risk when it comes to being pregnant. So a whistle-stop tour of the physiology, because I'm hoping everyone listening to this should be well aware of how to get pregnant. But this is a very commonly held belief that I've heard many, many times among friends, women that I see at work, is that a woman can get pregnant any time of the month. This, unfortunately, is a myth. And we'll just have a quick look at why. So in order for you to conceive, 3 things have to happen. You have to ovulate, the egg has to be fertilized, and then you have to have implantation. So ovulation is when the egg is released from the ovary. In order to work out when you ovulate, you need to have a good working understanding of your cycle. So your menstrual cycle starts on the first day of your period and it ends the day before your next period. So it's a good idea, if you don't already, to track your periods. There's lots of apps out there that you can use to do that, and it will keep a record for you and tell you your average cycle length. You really need to be having regular periods in order to work out when you ovulate. So ovulation, as a rule, occurs about 14 days before your period. What happens at the start of every cycle, so on the first day of your period, your brain sends hormone messages down to your ovaries, and a number of follicles, which are sex-containing eggs, they all start to develop. By the time you're approaching the middle of the month, one of those follicles will have become dominant, and that is the egg that will be released to find its way to the fallopian tube and wait there to be fertilized. After that, the next stage is fertilization, which is not as easy as many people think. The egg itself is only available to be fertilized for about 24 hours after it's released. If it's not fertilized within this time, it simply gets absorbed back into the body, and your chances of pregnancy for that month are over. The sperm, on the other hand, survive for up to 5 days. And so when you're trying to get pregnant, it's really important that you work out what is called your fertile window. Your fertile window is made up of the times that the sperm survives and also the time that the egg survives. So as I said, ovulation generally occurs about 14 days before the start of menstruation. So if your cycle is 28 days, you can expect to ovulate roughly around day 14. So your fertile window will start 5 days before then, so day 9, up until a day or 2 afterwards, so up to day 16, just to be on the safe side. As I said, your fertile window is very dependent on ovulation, which is in turn dependent on your cycle length. So your fertile window is unique to each woman. This is what it would look like if your cycle length is 28 days. However, if your cycle length is only 24 days, then you can see that your fertile window would shift to the left, and it may even overlap with your menstruation, meaning that it is possible to get pregnant on your period. If your cycle is longer, so if it's say 32, 33 days, then your fertile window would shift to the right and further away from your menstruation. How can you track your ovulation? As I said, the main method is menstrual cycle. You can only do this if your cycle is regular. If it's irregular, your calculations will be off. So you need to have a regular cycle. As I said, there's apps that can help you track this and keep a record so you can work out when it's likely to be. Cervical mucus is another thing that lots of women use to track when they're going to ovulate. It changes throughout your cycle. It's usually quite thick and white, but around the time of ovulation, it can become very thin and runny and transparent. And it's more abundant at that time as well. Basal temperature is another thing. You need to have a very sensitive thermometer because your temperature drops very slightly around the time of ovulation. It's only by about 0.4 up to 1 degree. So it is very sensitive, but that's another measure. Libido, a lot of women notice that around the time of ovulation, everything in their body seems to be screaming to them, get pregnant now. So if you notice that your libido is dramatically increased at a particular time of the month, you're probably ovulating then. I forgot to add to the slide actually, but there's also a condition called Mittelschmerz, which is where women get pain in the middle of the month, and that's usually coinciding with ovulation. Or just to be on the safe side, I should also add it can also occur up to 24 hours before ovulation. So if you're using, say, the family planning method for contraception, and you've got your pain and you think, right, I've ovulated, you've waited 24 hours, I'm safe to go now without any other contraception, give it at least another 24 hours. Because as I said, menstrual schmerz can occur 24 hours before you actually ovulate. And the last way of tracking ovulation is to use an ovulation kit. There's different varieties, different brands. You can pick them up easily at your local pharmacy. And then the last stage, as I said, is implantation. This occurs roughly 6 days after fertilization, because that's how long it takes the eggs to travel down the fallopian tube and implant into the womb lining. So that's a quick whistle-stop tour of the physiology of how things work. So how can you optimize your chances? The first thing I would say is to plan early. Age is really not on our side, particularly as women. We are born with all the eggs that we'll ever have. Unlike men who produce sperm all the time from puberty, we never produce any more eggs. Scientists reckon that we're born with roughly 1 million eggs, which sounds like a lot, but we start to lose them immediately. So as when we get to puberty, we may only have about 300,000 eggs left. That still sounds like a lot, particularly if you think, well, you know, if I start my period at age 12, go through menopause at 51, I have a regular period every month, that's only what, 450 eggs. So 300,000 is more than enough. However, as I said, several follicles start to develop every month and not all of them get used. And it's not just 6 or 7, but scientists again reckon that we may be losing about 1,000 a month. So it's really important that if you're thinking, if you would like to have children at any point, that you do plan early, not necessarily start early, but at least have a plan in place of when you are likely to start. If you're going to be leaving it later, the other thing to worry about, in addition to having a decreasing number of eggs, is the fact that the quality of eggs also decreases quite dramatically with age as well. When you're 25, roughly about 75% of your eggs will have normal chromosomes. When you're over the age of 40, 45, that drops quite dramatically to only 10%. And that's why the risk of miscarriage increases so dramatically with age as well. Now, there are options such as egg freezing and egg donation, but success rates with those are generally lower. And so it's really important to be quite realistic about the outcomes that you're expecting to achieve. If you're thinking that, you know, I want to do my career or whatever else first, and I'm thinking about freezing my eggs, again, the earlier you freeze, the better, because you want to be freezing good quality eggs rather than poor quality eggs. So I don't say all of that to frighten people into thinking I need to get pregnant today. But as I said, it's important to take the same care in planning your fertility as you would, say, your career. Diet and lifestyle, very important. Vitamins, we recommend that you start taking folic acid and vitamin D at least 3 months before you start trying to get pregnant. The normal dose of folic acid is 400 micrograms. Women who are obese or who have certain medical conditions and are on certain medications will need to take the higher dose, which is 5 milligrams. Folic acid is super important for cell division, and particularly so for formation of the neural tube, which is part of the nervous system. The nervous system kind of starts off flat and then it folds into a tube and it zips up, so to speak. And folic acid is essential for that process. If you don't have that, then it doesn't zip up correctly and it may be left open at either end. And these are examples of some of the disorders that can result. So the top, you've got problems where it hasn't zipped up at the top properly. So the worst of those is anencephaly, which is where the brain is missing. And then the bottom row shows issues at the bottom end of the spinal cord. So that's your spina bifida. So that's why folic acid is important. Vitamin D and calcium are really essential for bone development and growth. The fetus uses up loads of a woman's calcium stores, so it's important that you're taking enough in while you're pregnant and even beforehand. Ensure an adequate iron intake. Again, your iron stores can get depleted during pregnancy, so it's important that you're starting off from a good foundation. Not only can you become anemic and have lots of issues with the anemia, but it also predisposes you to having a big bleed after you deliver if your iron stores are not adequate. It's also important to avoid foods which are high in vitamin A, like liver, because that can cause congenital deformities. And also avoid uncooked meats and pâtés, things like that. These are the stats for the UK for our population. This report is from 2019, so the data goes up to the end of 2018. And as you can see from our current population, 61% of women are either overweight or obese, and it's 67% of men. And these figures are increasing year on year. Now, why is this important? Obesity significantly increases your risk during pregnancy. It increases your risk of developing blood clots in the legs and the lungs, developing diabetes, high blood pressure, macrosomia, which is where the baby is abnormally big, for want of a better phrase, which then can lead to birth trauma, both for you and for baby, increased risk of neonatal death, and postpartum hemorrhage, which is having a big bleed after you deliver as well. So exercise is important for maintaining a healthy weight. Lots of myths are floating around about you shouldn't exercise in pregnancy, it predisposes you to miscarriage. There's absolutely no evidence to support that. In fact, exercise is encouraged to try and help with you gaining an appropriate amount of weight during pregnancy. Lifting weights is fine as well if it's what you used to do before. That's the key, really. You need to be doing what you're used to. Pregnancy shouldn't be a time for you to be trying new things like, oh, I'm going to suddenly start weightlifting. But if you were weightlifting before, then it's fine for you to carry on. Smoking and alcohol are really detrimental for both you and baby. During pregnancy, it causes issues with the baby gaining an appropriate amount of weight. It can lead to premature births. It can lead to cognitive abnormalities in the fetus as well. So it's really important that you avoid both. There is no safe level of alcohol in pregnancy that's been found, so it's better to just avoid totally. If you smoke, giving up at any point in the pregnancy will be beneficial, but you'll see the most benefit if you give up before week 15. The other important thing to do is to optimize pre-existing conditions. Lots of the chronic illnesses like diabetes, epilepsy, asthma, sickle cell, thyroid disease, all of these problems can have adverse impact on pregnancy, and pregnancy can adversely impact them as well. So it's important that if you suffer from any of these things, you consider going to see your GP or your hospital specialist before you even think about getting pregnant. Diabetes particularly, you should be aiming for an HbA1c less than 48. Anything above 80, you should not be thinking about pregnancy at all, because it's really dangerous for both you and baby. So get some help, make sure your conditions, your pre-existing conditions are optimized as much as possible. Make sure you're up to date with your vaccinations, because there's vaccinations that you cannot have during pregnancy. I'm thinking particularly MMR, because getting measles or rubella during the pregnancy can really have problems for baby, and baby can die in the worst of circumstances. Smears as well, you're unable to go for a smear while you're pregnant. So if you're due, get it done before you get pregnant. And if you become due while you are pregnant, then you have to wait until 3 months after you deliver in order to get your smear done. Contraception, there's lots of different options out there these days. So obviously, if you want to get pregnant, you have to stop your contraception. With most methods, fertility will return straight away. The method that has been definitely shown in the research to have an adverse effect on fertility is the injection. That can cause a delay in your return to fertility of between 12 and 18 months. So if you're using that for your contraception, it's important to bear that in mind if you are thinking of starting a family in the near future. Some women will stop the injection, fall pregnant immediately, but for others, it will take up to that 18 months, so bear that in mind. Anecdotally, with the pill, it hasn't really been shown in research to cause a delay. And indeed, lots of women will get pregnant straight after stopping the pill. However, for some women, it can take up to 6 months. And that's just because it can take a while for you to start having ovulatory cycles again. So again, if you want to start trying at a certain time, it might be best to kind of build that into your planning. Regular sex, you need to have sex often and in the right place. So what I mean by that is the research suggests having sex every 2 to 3 days is beneficial. As I said, sperm lasts up to about 5 days, but if you have it every 2 to 3 days, then you ensure that there's always some sperm hanging around waiting to see the egg. Also, the research has shown that long periods of abstinence are detrimental for sperm quality. So if you want to deliver the best sperm, you need to be having sperm often and in the right place. What I mean by that is you'd be surprised the number of colleagues I have who have seen patients wondering why they're not getting pregnant, and they're having sex in, say, the belly button because babies grow in the stomach. And so they believe that that was a place to have sex. Any alternative other than vaginal is not going to get you pregnant. And so that's where you need to be having sex. Utilize your fertile window. We talked a bit about this already. This is when you're most likely to get pregnant. As I said, the egg only lasts for 24 hours. After that, it's absorbed, and that's your chance for that month gone. So you really need to be aware of when your fertile window is and utilize that to your advantage. And the last thing is to not stress as much as possible. Trying to get pregnant can be a really stressful experience, particularly if you've always thought, you know, when I want to have a baby, I'll just try and I'll have one and that will be it, because that's not reality for a lot of couples, and it can be a very stressful experience. But the stress hormones have an adverse impact on your hormones which stimulate ovulation, and they can actually cause a delay in ovulation or for ovulation to not occur, which is obviously not going to help you get pregnant. So try and relax as much as possible. Try and leave the calendar alone. And I know I spoke about ovulation kits, but sometimes all of these things can just add a bit more stress to the situation. So try and remain as relaxed about it as possible. So a quick word on when it doesn't go to plan, because as I said, it doesn't always go to plan. So if you look at miscarriage, first of all, which is the loss of a baby before 24 weeks, it's most common in the first trimester, so within the first 12 weeks, and it impacts 1 in 4 women. So it is very, very common, but it's something that's not commonly spoken about because it's a bit of a taboo subject. Your risk does decrease quite dramatically in the second trimester, down to 1 to 2%, but it can still occur. It is most commonly due to a chromosomal abnormality in the fetus, so usually it's not preventable. There are lots of myths, again, floating around about miscarriage, that, you know, it must have been something that you've done, or that if you had bed rest, it wouldn't have happened, or as I mentioned, you know, it's because you were in the gym doing exercise. There's no evidence to substantiate any of these. The most common cause of miscarriage is that there was a chromosomal abnormality. As I said, as you get older, your egg quality decreases, so it's more likely to happen. Same in the male, sperm quality can decrease due to a number of factors, including age. And so it just makes it more likely to happen, basically. In terms of trying to conceive after a miscarriage, there's conflicting information that I've heard from people about whether or not you should wait and how long you should wait. Actually, there's no need to wait at all. You can try to conceive straight away if you want to, if you're in an emotional place and physical place to do so. We do say to try and wait for your first proper period after the miscarriage, but that's purely for our benefit, so it makes it easier to date the pregnancy. If you feel that you'd like to try beforehand, that's totally up to you, and there's no medical problem with doing that. Most people after having a miscarriage will go on to have a successful pregnancy, but unfortunately for about 1% of women, they will suffer recurrent miscarriage, which is when you have 3 miscarriages in a row. Risk factors, as I said, age is the biggest one. Your chance of having a miscarriage when you're between the ages of 20 and 25 are about 11%. It goes up to being over 25, it goes up to being 25% over the age of 35, 51% over the age of 40, and 93% over the age of 45. So as you can see, there's quite a dramatic increase in the risk of miscarriage there. Chromosomal abnormality, as I said, in the fetus is most common. That accounts for about 70% of causes. Occasionally, both parents can have a chromosomal abnormality as well, which is getting passed on to the baby, and that's why the fetus keeps self-aborting, and that happens in about 5% of cases. Antiphospholipid syndrome is an autoimmune condition closely related to lupus. It increases your chances of clotting, as do the thrombophilias. They're all conditions where your chance of clotting are much higher. You tend to get a lot of microclots within the placental vascular system, and that's what causes the pregnancy to abort, because the baby's not getting enough nutrients. Endocrine disorders such as diabetes and thyroid abnormalities are also contributory to miscarriage. Smoking and alcohol, and also previous miscarriage, as I said, can increase your risk. And then infertility, surprisingly common. It affects about 1 in 7 couples. So most couples under the age of 40, if they're having regular sex, 80% of them will conceive within the first 12 months. And about half of those who didn't conceive the first time around will conceive within the next 12 months. So that's about 90% within 24 months. About 25% of cases, the cause of infertility is unexplained. You can see the list of other causes there. It's often thought to just be a female problem, even in like the media. Often the female is blamed as being the one who's unable to have a baby. But actually, as I've just highlighted there, male factors are the cause in 30% of cases. That's nearly 1 in 3 cases. It will be an issue in the male. And in about 40% of cases, there's disorders found in both the man and the woman. And it's actually quite sad sometimes that it's just those factors acting in synergy that make it impossible, so to speak, for them to have a baby. And if they were with different partners, they may not have had any issues at all. So in terms of trying to protect your reproductive health, this diagram is just kind of a summary of the hormones involved. So an area in the brain called the hypothalamus sends hormone messages to the pituitary, which then send hormone messages to your ovaries and testes to get them to produce eggs and sperm respectively. And anything that interferes with any part of this pathway will impede your chances of getting pregnant. So as you can see at the top, things that affect your brain, things like surgery, certain drugs, particularly, I don't want to be sexist, but steroids, for those of you that really love using the gym and are partial to steroids, they have an adverse effect. They help you produce testosterone, but they stop you, they increase one of your body's mechanisms of producing testosterone, but they actually decrease your own testosterone, and so they stop your testes from making sperm. Stress, we've talked about. Sudden weight loss, I've talked about in another presentation that your body knows to go through puberty when you hit a certain weight. So if you then go under that weight, your pituitary will stop producing the hormones to make you menstruate, etc., because you're trying to conserve energy, basically. The ones that are grayed out are things that you can't really impact. Things that affect you lower down more locally are things like sexually transmitted infections. Chlamydia is a really big one, particularly because it's silent. It's the most common STI in like 18 to 25-year-olds. Often there'll be no symptoms, but it can be really devastating inside. You can get blockages of your tubes. So obviously the egg can't get down, the sperm can't get to the egg, you can't conceive. Unhealthy weight we've spoken about as well, that can play havoc with your hormones, meaning that you don't ovulate frequently, you don't menstruate frequently. Any trauma to the uterine lining, so if you've had to have a scrape for any reason, maybe if you've had a previous miscarriage, you've had surgical management, or if you've had a surgical termination before any surgery to the inside of the womb, maybe if you've had fibroids removed, you can get scarring inside, and again that can impede the sperm and the egg meeting. Same on the male side, STIs can damage the sperm, the tube that they travel through to get out to the egg. You can have congenital absence of the vas deferens, which is the tube that they travel up in. Conditions like cystic fibrosis and other genetic conditions as well can all impact that. So in terms of the things that we can do things about, I've put there in black. So avoiding STIs, practicing safe sex, if you're changing partners, getting checked, maintaining a healthy weight, avoiding stress, and being aware of the medications and drugs that you're using. And just to end on some points that are good to know, I asked a couple of my friends what did they wish they knew about getting pregnant and before they got pregnant. So one thing was the smell, that your sense of smell can be really heightened. For me, that was one of the first things that let me know I was pregnant the first time I got pregnant. I remember cooking some dinner and I couldn't stand the smell of it, but I thought, no, I just need to finish cooking it. I cooked it and I immediately threw it in the bin. And not only that, I took the bin bag out and put it outside the house. I couldn't stand to have it in the house. So heightened sense of smell is one thing to be aware of. Morning sickness, which can be morning, noon, night, or all day sickness, can hit you at any time. It can be really, really difficult to manage and to cope with. It can last much longer than the 12 weeks. For me, it's lasted up to 20 weeks at times. So it can be, and I know I have friends where it's lasted throughout the entire pregnancy. At its worst, you can have something called hyperemesis gravidarum, which affects roughly up to 1% of pregnancies, which is where not only are you being sick, but you're not able to keep any food or fluid down at all. You get dehydrated, you get electrolyte imbalances, and you lose at least 5% of your pre-pregnancy weight. That can be really, really tough for women to cope with. I've had patients request terminations because it's been so distressing. Know that if you are ever at a point where you're unable to keep anything down, then you do need to seek medical help, because there are things that we can do to try and help the situation. And leaving it untreated is bad for you and bad for baby. Sleep position is another thing my friends said they wish they knew about towards the later stages of pregnancy. So after 20 weeks, it's recommended that you don't sleep on your back anymore, because you're impeding the blood supply to your uterus and therefore to baby. So sleeping on your side is recommended. Pelvic girdle pain can be another unexpected development of pregnancy. One of the hormones produced during pregnancy, called relaxin, really makes all your ligaments and joints relax, which is necessary to allow the baby to pass through the pelvis. But when you're not quite ready to give birth, it's just a pain, because it means that you're more prone to injury, and you can also be in quite significant pain. Excuse me, walking, trying to roll over in bed. You can end up on crutches or even in a wheelchair. So it can be quite traumatic. And also pelvic floor. Your pelvic floor is kind of a bowl shape of muscles that support all of your pelvic organs, and that's what helps give you continence control. Your pelvic floor is weakened by pregnancy, not only because of the hormones that are produced, like relaxin, as I already mentioned, but also because you've got this big ball of a baby just sat on it. So you've got this constant weight of a watermelon on it. So a lot of women actually find that they have problems with continence towards the end of pregnancy and also afterwards. It may be that you're going all the time, up to even leaking when you don't want to. So it's really important that you do your pelvic floor exercises throughout pregnancy and definitely afterwards. Seek help early if you need help. There's physios out there, there's various management methods. So don't suffer in silence when you don't have to. And I think I'll leave it there.
Now we welcome Dr. Guti. Thank you, Stacey, for the presentation. Dr. Guti, it's now your time as well.
Oh, okay. Hello, everyone. Is it possible to be allowed to share content so that I can screen share? Can you see the screen?
Yes.
Oh, okay. Thank you. Right. Thank you. And thank you, Stacey. I think she's covered most of the things. I was asked to also present, but to concentrate more on the men. And if I look at my parents' generation, when they did turn up, for example, with their wives to any midwife, I think one of the questions would be, can I help you? And I'm sure we all know there are two different types of can I help you? There's a can I help you of what on earth are you doing here? And then there's a can I help you as in genuinely wanting to help. For that generation, it was a can I help you as in what on earth are you doing here as a man? This is things for the ladies. But as we know now, things have moved on. And certainly it is important for men as well to understand what happens, particularly preconception, which is what I'm going to cover, but it will be a short presentation. Why is it important to address preconception in men? Of course, it does ensure all pregnancies are planned and wanted. It's recognizing that it's not only the responsibility of the lady, but also it's a dual responsibility. Also, it can affect the partner's chances of falling pregnant. So like Stacey have alluded to, that of course there's a lot of planning to it so that you can time it well around the time when the lady is most fertile. Also, it does help in preparing men for fatherhood, because usually we just suddenly become fathers when the baby pops out, but actually we should understand that there's a lot of planning which is needed beforehand. And by participating in preconception, it actually prepares you mentally for what is to come. And also disease prevention and health promotion in men. I'm talking as a man myself, that men generally, you find it hard to take them to the GP or to seek any help. They don't want, they will probably just die there in the house, not seeking any help. But if there's any preconception health program, it does help, because of course they will look into the health issues which men have. So it is an opportunity for any health issues to be picked up, and particularly if there's any chance of preventing some illnesses, like Stacey have already mentioned, things like obesity. Also, it's about the future health of the baby, which we'll talk about as well shortly. So indeed, your health matters, and age does matter in this, because we do know that men can still make sperms up into their 70s and beyond. But the unfortunate bit is the quality of the sperm declines with age. As you know, for fertility, as already alluded to, the quality of the sperm as well as the amount is very important, and the quality does decline with age. And if we are over 45, it just means conception might actually take longer, and actually there's also greater risk of miscarriage if, and we're not talking about ladies, but if the man is above the age of 45. Also, science, according to research, also it says the older fathers are at slightly higher risk of having a baby with autism, and also some mental health conditions like schizophrenia. And this is actually research-based, that for the older daddies, I think you've heard about the ladies as well, the risks, but particularly for the men, there's a higher risk of autism and schizophrenia. So of course, you can't control your age. So I guess that's why we are having this, so that if you do need to plan, perhaps if you are approaching those ages of 40s, you might need to plan as soon as your circumstances allow. I think Stacey did mention about infertility, that men have a significant contribution. In the good old days, people would always blame the woman for infertility, but we know now about half of the infertility cases could be due to the father. By half, I don't mean 50% causes of infertility, but it's about 30 to 40, and then another 30 for ladies, and then the rest will be like joint causes for infertility. So certainly, men do need to have a general medical checkup to ensure that, for example, if there is infertility, it's not due to the men. And also, a healthy sperm does improve conception. And I'm sure you'd agree with me, it's not only because God wanted to have a good sense of humor by making the testicles just dangle there. It's because they are supposed to stay in cool or cold situations, environment, so that this can help preserve the sperms. So if you're wearing very tight underwear, almost as if you are trying to push the testicles back into your body, it means the temperatures, they can't withstand them, and the quality of the sperm, as well as the amount, is reduced. I'm of course not encouraging you to go and wear very baggy underwear, but I'm saying you have to be moderate about the underwear you wear, particularly if you're planning to conceive. Also, STIs, they've been mentioned already, can lead to infertility by affecting the tubes, and it is a good thing to have them tested before. And then being a healthy weight increases your chance of conceiving a healthy baby. Again, it has been mentioned, like extremes of weight, so obesity, if your body mass index is above 30, that's obesity. If it's 25 to 30, that's overweight. But the opposite applies if you're very underweight. So if your body mass index is maybe around 17 or 18 or less, it does affect the chances again of conceiving because the quality of the sperm is affected by all that. And of course, the more weight you have, the reduced sex drive you have, which makes it difficult for intercourse. And the best way, of course, of achieving a healthy weight is nutritious diet and exercising regularly. There are a few don'ts, which is smoking. So smoking does affect your erections because erections are dependent on good supply to the penis. And if there's smoking, it affects your blood supply, which affects the erections, which again will reduce the chances of conception. But also smoking contributes to damaging the DNA in your sperm. And this is why men need to lead a healthy lifestyle because sperms are also dependent on a healthy lifestyle. So if the sperm is affected or the DNA in the sperm is affected, it means there's increased chances of other diseases, for example, blood cancers like leukemia. Also, heavy drinking would affect sex drive and sometimes the quality of the sperm. And then if you're taking certain medications, like Stacey has already mentioned, I'll mention particularly the anabolic steroids because men do want to do a lot of bodybuilding. So those who do use anabolic steroids, they can actually stop you from producing sperms. And in addition, they can actually shrink the testicles and hence does affect erection and your sex drive. And it's unfortunate that with anabolic steroids, especially if you've used them for a number of years, it can take up to 2 years for you to be healthy or to produce healthy sperms again. And of course, recreational drugs are no good, particularly things like marijuana, cocaine, and heroin. And indeed, God wants us to do these things. Conception in Genesis 1 verse 28, it says, God blessed them and said to them, be fruitful and increase in number, fill the earth and subdue it, rule over the fish in the sea and birds in the sky, and over every living creature that moves on the ground. And in Psalms 128, David says, verse 3, your wife will be like a fruitful vine within your house. Your children will be like olive shoots around your table. I find this interesting because the vine is a very tender plant, which usually grows from inside a building, and then it grows it as it goes out, for example, through holes or through the window to grow outside. But then for it to bear the fruits, it means you've got to look after it, and it's the responsibility of the men to make sure they are looking after their tender partners so that they can have the children who are like olive shoots around the table. And I'll end there.
Thank you, Dr. Guti and Dr. Stacey. Now we'll start our opening questions. I'll ask Najo and Chido if you can start with the questions. Thank you.
Yes, afternoon, everyone. And thank you so much, Dr. Stacey and Dr. Guti, for your very clear presentations. One of the questions we have is, does the Bible say anything about using or not using contraception? And also, are there any contraceptives that we as Christians should avoid?
The short answer is no. I don't believe the Bible says anything about using or not using contraception. In terms of contraception to avoid, the only one Christians may want to avoid probably is the copper coil. And that's because the copper coil is also used as emergency contraception. And the reason for that is it can interfere with implantation. So if you're of the belief that the start of life is at conception, then you don't want to be interfering with implantation or anything afterwards. I know some people believe that life starts at implantation, so for them it's not an issue. But as I said, if you're kind of in the former camp, then avoid the copper coil. Anything else is not going to interfere. Anything else all works before ovulation, so it's all fine in that regard. And that's talking about normal contraception, though, not emergency contraception, which is a slightly different category.
Thank you.
Yeah, and just to add to that, like Stacey has said, yeah, I don't think there will be any like biblical reference to it, but I guess we can infer from what the Bible says, but also it will be useful sometimes to also visit like Spirit of Prophecy. And in the Adventist Home, I found this very interesting article, page 162, where it says there are parents who, without consideration as to whether or not they can do justice to a large family, fill their houses with these helpless little beings who are wholly dependent upon their parents for care and instruction. This is a grievous wrong, not only to the mother, but to her children and to society. Before increasing their family, they should take into consideration whether God will be glorified or dishonored by their bringing children into the world, and thus supporting contraception.
Thanks for that. I think it's quite useful to have reference from Spirit of Prophecy that family planning is important and is something that God wants us to consider and to do. So thank you for that.
Thank you. So we had a few other questions regarding the certain forms of contraception, whether using the morning after pill. And the question was, what kind of effect does they have on your future pregnancy? For example, if you had taken a considerable amount of morning after pills, what impact will they have on your pregnancy or you getting fertile?
None. So there's 3 different options for emergency contraception. 2 of them are pills, and the last one is the copper coil, as I mentioned. So the first pill is called Levenel. That can be used up to 3 days after unprotected intercourse. That works by delaying ovulation. So it only really works if you take it in the first half of your cycle. Taking it after you ovulate will have no impact. The second pill is Elawan. That is also thought to delay ovulation by up to 5 days, but it can also impair implantation. So again, that may be one to avoid if you don't want to interfere with anything after ovulation. Now, both of those pills, the half-life ranges from 26 to 34 hours, by which I mean, by the time you're 34 hours down the line, half of it is out of your system and it continues to decrease. So it doesn't have any, excuse me, long-term impacts. And in fact, while you can have a period of unscheduled bleeding after using the morning after pill, so usually in about 7 days' time, depending on where you've taken it in your cycle, 7 days later, you can get like a period, so to speak, about a week of heavy bleeding. But then after that, you resume normal cycles. So it doesn't have any long-term impact on fertility at all. The copper coil, on the other hand, if you're using it as an emergency contraceptive, you generally leave that in place, and you can leave it in place for between 5 to 10 years. So if it's still in place, then it will be a contraceptive, but as soon as you remove it, the contraceptive effect is gone. So if you have a coil in place, as soon as you take it out, you can start trying to get pregnant.
That sounds good. Because there's always myth that say, if you're using those kind of contraception, you might have impact on your baby because it's not natural. So going the natural way might be proof beneficial, but no, that is good.
You know, the important thing to realize with those contraceptives are they contain the same hormone that you're making in your body anyway. And the way that they work, by providing that supplemental hormone, they stop your body from making its own. But it only lasts for that period of time that you're taking it. And it's a one-off dose. So by the time your next cycle resumes, you'll be back to normality for yourself.
We've got a question from Instagram and say, does the church have a view on ligation and vasectomy? And yes, for our viewers who may not know what ligation and vasectomy are, if you could please briefly explain as well.
Okay. To my knowledge, no. I don't know if anyone has read the church manual and knows any more than me, but to my knowledge, I don't believe they have a view on it. Dr. Guti, what do you think?
No, not as far as I know. I don't think church has got any position on it per se, because obviously that's more of a personal choice in terms of the contraception. So I don't think there's any church position on it.
Oh, and you wanted us to explain it. So,
yes, please, yeah.
Oh, okay.
So vasectomy is cutting the vas deferens. So it's cutting the tube that the sperm travels up. And ligation is either cutting or tying or placing a hoop around your fallopian tubes. There's a couple of different ways that we do it.
So these are not reversible once you go that.
So they're irreversible. Well, they're not reversible on the NHS. You can pay to have them reversed privately, but the success rates are not brilliant. So we say that they're permanent.
Okay, so we have another question which talks about what male contraceptives are available. Are male forms of contraception safer than female options? So pretty much, are there any other contraceptive methods besides the condom?
There was one in development. They did actually develop a male contraceptive pill. But the reason why it hasn't come out to market yet is because the men complained that the side effects were too bad. The side effects are exactly the same as the female pill, which is really interesting.
Wow.
We have to put up with it, but apparently men can't cope with headaches, so there is nothing else at the moment.
Okay. So for the side effects, yeah, I've covered that.
So we'll move on to our next question. Dr. Picard, you mentioned something about having sex, at the right time. Are there any natural aphrodisiacs that can help get the mood going and just aid in regular sex that is intimate rather than just purely mechanical to get pregnant? Like this is the week we have to have sex every day.
Yeah.
Is there anything that couples can do to actually help them, get in the mood and still, maintain good levels of intimacy while, aiming to get
I think it's probably going to be couple specific. It's probably going to be different for each couple what gets them in the mood. I wouldn't say there's a one size fits all. As I said, it's really important to try and take the pressure off, because once you get fixated on dates and times and numbers and we have to try now and I'm coming home, I'm going to be home in half an hour, get ready, like you kind of take all the fun out of it. And people find it hard to perform under that kind of pressure. To try and keep it as relaxed as possible. I don't know if there's any natural aphrodisiacs that I can think of. I don't know.
Well, yeah, I agree as well with Stacey. I don't think there will be any need anyway to use the natural aphrodisiacs. Particularly, the assumption is that we're talking about relatively young people whose organs are functioning very well. I think it's more about just making sure that the environment is still romantic for you. Like Stacey has said, it's about what the couple wants. So as long as you keep that spirit of good romantic environment, then certainly that's good enough, I think, an aphrodisiac in my eyes. But I don't think you would need at all to supplement, because once you do, it doesn't take away the mechanical side you were talking about. It can still be mechanical with the aphrodisiac. But the most important bit is keeping the romance alive during that period, even if it's involving like, oh, okay, I know my partner likes going out for a nice meal, then that's what you do to just prepare your mood for it.
I'd just add to that as well, beware of lubricants. Some lubricants are not sperm friendly. So if you're trying to get pregnant, be really careful with that.
That's true. So just another pre-question from Instagram that we had. It says, can I breastfeed when I'm pregnant with another baby, or do I have to stop?
Yes, you can continue breastfeeding. It's absolutely fine. There's going to be no detrimental impact to you or the child you're breastfeeding or your baby. You may notice that your milk changes a bit around 5 months onwards, because it kind of goes back to getting ready to give colostrum, which is the first milk that you give to baby. And you may have a slight change in your supply then as well. But other than that, there's no negative impact.
From YouTube, you touched on this during your presentation, Dr. Pickard, but what advice would you give to a woman who is overweight and looking to get pregnant? Is it better for them to lose weight before getting pregnant? But also, what if the clock is ticking and perhaps they do not have time to get in shape for pregnancy, or maybe they're already pregnant? What new but safe things can they do to reduce the risk of any complications?
Yeah, so definitely try and lose weight before you get pregnant. You'll probably find that it makes getting pregnant easier as well. So if you're struggling to get pregnant, that is a good place to start. Again, during pregnancy, there's often this phrase that goes around, oh, you know, you're eating for two now. You're not eating for two. You're eating for yourself and like a peanut until the last trimester. And even the last trimester, you only need an extra 200 calories a day, which is like a Mars bar. So you do not need to be eating huge amounts during pregnancy. I think on the NHS website, there's guidelines as to what is a safe amount of weight to gain during pregnancy. If you're starting off from a place that's underweight, you need to gain a little bit more. If you're starting off being overweight, then you need to gain less, if none at all. Well, I wouldn't say none at all. You will inevitably gain some because of the baby and the fluid, etc. But you should be gaining much less. Pregnancy is not the time to be dieting, but as I said, exercise is safe during pregnancy as long as you're not overdoing it. So things like swimming, if you were going for walks, jogs, if you were doing weights before you got pregnant, continue. But yeah, you shouldn't be putting on too much weight. We already discussed the risks to yourself in the pregnancy.
Just to add to that, there's a reason why they are saying you shouldn't fall pregnant when you've got uncontrolled chronic medical conditions like diabetes, or if you are overweight or obese. It actually means you are putting the baby at risk. So that's why you can't bypass that step of controlling it first before you actually become pregnant.
Right. So on another question, it says that does masturbation reduce sperm count, and how do you improve low sperm count and sperm strength, quality, and healthy? I guess a healthy sperm.
So yes, your sperm count can drop in between the more often you're ejaculating. So the more often you have sex, the more often you're masturbating, you will by nature get less sperm with each subsequent ejaculate because of how long it takes to produce sperm, but you don't necessarily get a decrease in sperm quality, which is the more important thing. I don't want to say most important, but it is slightly more important. Because when we analyze sperm, number is one thing, but we look at also motility, which is how well it moves, morphology, which is whether or not it's got a normal shape. So it's all well and good having loads and loads of sperm, but if they're not moving anywhere, you're still not going to get pregnant. And if they have an abnormal shape, they're still not going to be able to do their job. So you need to have normality in all of these ranges. Have I answered the question? What's the more to the question?
No, I think I agree with you, Stacey. I mean, just to add on to that, I think Stacey did mention it in her presentation as well, that the cycle for sperms will be, I guess, about just over a month to 3 months. cycle where you get like completely new ones. So for example, the more regular sex you have, the more like new fresh sperms you have in the system, which enhances your chances. So for example, when you're giving preconception counseling to men, we say, for example, the things we're saying, the don'ts, as well as things like the good things like exercise, we would say do it for at least 3 months to allow for that period where if there were old sperms, which maybe have damaged DNA, they are now out of the system. But then if you're specifically asking about masturbation, that's a completely different ball game, because I mean, there might be moral or whatever biblical implications to it. And there's absolutely no reason for you to do it if you've got your partner in a married situation. It means you just need to have more regular sex, because I can't see the justification for having the masturbation in that situation.
Right.
Just as a follow-up on that, in terms of the quality of the sperm, how do you maintain or how do you improve the quality of the sperm?
So it's about everything which Stacey mentioned about the ladies keeping healthy. So it's about, for example, eating fruits and vegetables, exercising regularly, avoiding smoking, heavy drinking, caffeine-containing drinks, as well as recreational drugs. So it's just about the same principles of like living healthy, because all these body cells are kind of similar. So the principles you'd follow for your heart are pretty much similar to the principles you'd follow if you want a healthy sperm.
And keeping your sperm at the right temperature as well. So not wearing underwear that's too tight, not working with your laptop on your lap all the time, things like that.
Right.
Thank you.
Thank you. How about actually, just on that, I hear a lot of men say, oh, I need to drink a lot of tomato juice. And is it just, is there something in that tomato juice that makes the sperm? I don't know. Can you help us understand on that?
Well, as far as I know myself, regarding tomatoes or tomato juice, the benefit is to the prostate gland, which is the tiny gland which surrounds what's called the urethra, which is the tube which runs from the bladder to outside, and which is the same tube which the sperms would run through. So they are proven scientifically that if the more tomatoes you eat, the better for your prostate. But I don't think there's any direct link per se to sperm specifically. But I think it's more about the prostate. And if the prostate is good, it means the tube, which is linking, for example, the sperms to go out, either into the womb, are remaining intact, as opposed to being pressed on by the prostate gland if it gets enlarged.
Right.
Thank you so much. I think we had quite a few questions from the ladies around contraception, and I think there were quite a few concerns around contraception being disruptive to the body's natural function. And so, which forms of contraception have the fewest side effects? And I think there were a few questions around whether hormonal contraceptives are the most disruptive, and are they really safe to use?
Okay. So there's lots of different types of contraception. There's reversible and irreversible, as he's spoken about. There's short acting, long acting, hormonal, non-hormonal. The effectivity varies. Probably the most effective one is the coil. So the Mirena coil, the copper coil, they both have an effectivity of about 99%, which means they'll prevent 99% of pregnancies. So they have really similar efficacies to the permanent methods, which is female sterilization. The failure rate of that is about 1 in 200. Male sterilization, the failure rate of that is about 1 in 2,000. So we're talking really small numbers. Those are the most effective ones. At your kind of least effective, you've got the family planning method, which is where you're just simply tracking your ovulation, trying to calculate your fertile window, and either avoiding sex during the fertile window or using other contraception like condoms during that time, and then using nothing for the rest of the cycle. Effectively, that I've just got it written down here. So with typical use, that's about 76% effective at preventing a pregnancy. Then next, you've got your condoms, which are effective up to about 82%. So as you can see, that there's quite a big gap there between that and the 99%. In terms of hormones, so the hormones in the hormonal contraception mimic your normal bodily hormones anyway. What would normally happen is during a cycle, your hormones fluctuate. When you're taking contraception, it eradicates that. It just gives you a steady state of hormone. And what that does is it stops your brain sending a signal to your ovaries to produce its own. And that's how you prevent ovulation. So if your contraceptive contains estrogen, that's how it works, primarily by preventing ovulation. If it's a progesterone-only contraceptive, then it primarily works by thickening the cervical mucus and making it unfavorable for the sperm to get through to meet the egg. In terms of long-term effects, as I said, usually there's no long-term effects, nothing that's been proven by the evidence anyway, apart from the injection. We know that that can cause a delay in return to fertility for 12 to 18 months. So as I said, it's really important to factor that in if you're wanting to have children in the near future. Other than that, usually your cycle should return immediately after you're stopping any other type of contraception. I did also mention with the pill, sometimes while your cycles may come back immediately, your first few may not be ovulatory, and you need to ovulate in order to conceive. So if you find you've come off the pill, but you've not got pregnant in your first couple of cycles, it's probably because you're not ovulating. But then once you start ovulating again, you should be able to get pregnant with no issues, providing there's no issues in the male or anything else.
Okay. I think as well, perhaps anecdotally, some people have found that hormonal contraception may contribute to weight gain, or I don't know, acne, skin irregularities, and other types of side effects. Is this fact or myth?
No, it's definitely fact. The only one that has been proven to cause weight gain, again, is the injection. Or the rest, I've heard it anecdotally sometimes with the coil, but the evidence doesn't support it. So it's not to say that it's not happening or it doesn't exist, but the data isn't there to support it being a common issue for the time being. In terms of other side effects, yeah, you can get acne, breast soreness and tenderness, particularly with like the combined methods like the pill and the patch. There are various things that you can do. So the pill has lots of different formulations with different hormones and varying levels of hormones. So it may just be a case of trying a different pill, which has a different combination. And you may find that your symptoms go away on that one, or you can try a different type of contraceptive altogether. There's so much variety out there that sometimes it can take you a bit of pick and mix, so to speak, or trial and error to find one that suits you. Libido is another thing that can be affected as well, I should say. Some people find that when they go on the pill, their libido decreases. Conversely, for some women, it increases. So there's no hard and fast rule.
Okay.
Another question here, this is on insulin dependent diabetes. Many associate it with the risk of miscarriage, fetal abnormality, and delivery. So they're asking, how can you prevent that in terms of you're suffering from diabetes and insulin? How can you prevent that, make sure that your pregnancy is safe?
Okay, so there are two types of diabetes. There's what's called type 1 diabetes, which perhaps I assume the person means saying insulin dependent, which is like more of an older term. And then there's type 2 diabetes, which is lifestyle related, which usually comes on at a later stage when you're a bit older. But again, it could still be childbearing age. But whether it's type 1 or type 2, the principles are pretty much the same, that when you do have diabetes, most of the risks, including the risks we're talking about to the mother and to the baby, come because of consistently high blood sugar levels. So the treatments which we give, like insulin, are trying to keep the levels within the range where people who don't have diabetes are. So for example, if you say the range is between 4 and 7, that's the range we are targeting by giving insulin, because insulin is going to reduce your blood glucose levels to that normal range. Once you are in the normal range, it means your risks then to the baby and to the mother are not at any much greater risk than someone who doesn't have diabetes. And that's why Stacey said in a presentation, when you've got a condition like diabetes, it's actually vital that before you become pregnant, you need to engage with the, especially the diabetes specialist nurses or your diabetes team, so that they can be aggressive in terms of the treatment to make sure that your levels are within the target levels. Once they are within the target, it means it reduces the chances. But when they are out of the range, because there's a lot of sugar, it means the baby is feeding from that lot of sugar, and then they grow too big to come out of the womb safely. And that's why you get complications from it. Also, they can get what are called malformations, which is abnormal development in some of the organs because of the excess sugars. And then obviously to the mother, it could be things like birth trauma due to the big baby, apart from the usual diabetes risks. So to come then back to that question, in short, is to say, if you do have diabetes, you ought then to let them know that I'm planning to have a baby well before you do. You might actually need at least a year to make sure your diabetes is under control, because it's not something which you would do like over a month or two. It's something which has to be done over a period of time.
I'd just add to that as well. In addition to the risk that you all mentioned, be aware of when you're going into ketoacidosis as well. The people with diabetes will understand, because that can be really detrimental for the baby. I think the risk of baby dying while you're having your acidotic episode is about 50%. So it's really essential you try to avoid going into ketoacidosis while pregnant.
So what is that mainly for women with diabetes, or for?
Yeah, so if they're insulin dependent diabetes, so in addition to all the other risks of your diabetes being outside of range, they can go into a condition called ketoacidosis as well, which they can have while they're not pregnant anyway, but it's particularly dangerous when they are pregnant to baby and to themselves.
Yeah, so basically you do get ketoacidosis when your diabetes, more prone when your diabetes is not well controlled, and particularly those who are still in denial stage, where they might not take their insulin every day, thinking, oh, they'll get away with it. And when you are pregnant, there are many hormones which oppose the action of insulin. They're called counter-regulatory hormones. So because of these excess hormones during pregnancy, it means you are more prone to get this ketoacidosis. And like Stacey has said, yeah, that can be highly fatal, particularly to the baby.
We've got a question from YouTube. The question is, what lubricants are sperm friendly?
I don't know. It's more about which ones aren't. KY jelly, I think, is not sperm friendly. I can't remember all of them, to be honest. Check the label is where I would start. If you can avoid lubrication, avoid it. But I get that if you're unable, if you're not producing enough naturally, then you may need to use it. So just be really careful when you're buying it. Check the label. It should say whether or not it's spermicidal or if it inhibits sperm in any way.
Yeah, indeed. Remember the romantic environment, that also helps in lubrication. So if you can avoid it, yeah, especially when it's around conception time, yeah, it's best not to use lubricants.
Okay. So this question is, I guess, more for Stacey. It says, does epidural increase risks of cesarean section?
No, not directly. Epidural can cause you to have a prolonged second stage of labor, by which I mean, so the first stage of labor is when you get regular contractions starting and progressive cervical dilatation up to fully dilated, so up to 10 centimeters. Then the second stage is from when you're fully dilated up until when you deliver the baby. So epidural can cause a prolonging of that second phase because you'll usually lay on your back. So gravity is not helping, you're not moving around again, so gravity is not helping. You often can't feel the contractions very well, so you don't push very effectively. Other than that, it doesn't directly lead, I mean, all of that in itself may indirectly make you need to have a cesarean section later on, but epidural itself doesn't directly cause you to have a cesarean section.
Right, okay.
Okay, so to change the subject a little bit, which we've been doing all along, I hope you guys haven't been getting whiplash from the way that the subject keeps changing. But is vasectomy safe? And what advice could you give, particularly to ease the minds of men who are worried about performance and function loss following the procedure? Could it lead to a loss of pleasure during sex?
To be honest, it's not my field. Urology does it, or the GP does it. I have assisted in some back when I was a medical student, so it's a very long time ago. In theory, no, it shouldn't impact performance or anything afterwards, because I don't know how graphic you want me to be describing the operation.
Go the whole way.
Go all the way.
All the way.
We're here to learn, so.
You inject the testes with local anesthetic. You make a very small incision, about a centimeter. You snip the tube, you tuck them away, the ends away from each other, and you stitch it back up. So you're actually away from the penis. It's all done within the testes. So it shouldn't have any impact on whether or not you're able to get an erection or anything afterwards. Or you'll notice, and you'll still be able to ejaculate. The only difference is that there will be no sperm within the ejaculate. So it shouldn't impact performance. But I have no doubt that perhaps in a small minority of cases, there may be some impact. But the best person to counsel you on that would be the surgeon doing the operation.
So just on that question, what will you be ejaculating?
Just fluid. All the fluid from the prostate and the seminal vesicles, all the fluid that normally makes up the ejaculates, just minus the sperm.
Yeah. So basically for sperms to be able to swim safely into the womb, they need a lot of fluids to protect them. It's almost like, fish can't swim where there isn't any fluid or water. So similar principles, sperms need that fluid. So the fluid mostly comes from the prostate gland. What comes from the testicles are just the sperms themselves, and then they get this fluid, which aids them, helps them going into the womb, but it also keeps the acidity in the right sort of, the right numbers so that they can go there safely and healthy. But also I agree that it shouldn't really affect sexual function, vasectomy, because it's purely done at the testicular level. So that shouldn't affect, because sexual function is purely dependent on things like blood supply to the penis, and so that shouldn't affect your function.
Thank you, doctors. You've probably eased the minds of a lot of people out there.
That's true.
That's true.
Thank you, guys.
So another question which always bugs me is, what happens after pregnancy? When can you start thinking of having sex and conceiving? Is it similar to the natural cycle that you can conceive after 14 days and your fertility window, or does it change after having the firstborn?
So you can start getting pregnant and start having sex as soon as you want to. we say to wait until you're bleeding after pregnancy, after delivery has stopped, only because if you're still bleeding, the cervix is still open and you're at risk of getting infection. But as soon as that bleeding has stopped, if you're ready, sure, start having sex again. Some women wait until their 6-week check because they're nervous. They may have had stitches because they may have had a tear or an episiotomy. They want to make sure everything's fine down there before they get back in the saddle, so to speak. Other women are happy to get going immediately, and so they do. So it's really individual specific, what you feel comfortable with. In terms of when you can get pregnant, it depends mostly on whether or not you're breastfeeding. So if you're exclusively breastfeeding and your periods have not come back at all, then that can act as contraception for the first 6 months. After that, you need to use contraception. If you are exclusively breastfeeding but your periods are back, then that suggests that you're ovulating, which means you can get pregnant. So in theory, if you're not breastfeeding at all, you can fall pregnant as soon as 2 weeks after you've delivered. So there's no need to wait. Yeah, you can try as soon as you're ready.
Yeah, sure. Yeah, just like Stacey said, I think it depends particularly on the recovery of the woman who's going through childbirth, because if it has been complicated, particularly knitting stitches, it means it will take longer, sometimes up to 2 months to heal. But if it was an uncomplicated pregnancy, then they might be ready after like a few weeks. So it's more of just individual circumstances and kind of, knowing and communicating with each other.
And one thing I would quickly add as well is that you should still be able to have sex even after you've had stitches, after you've had a tear, after an episiotomy. If you find that you're not able to, if things are too painful, it feels too tight, or for whatever reason, then that's not normal. And you should seek help for that, because there are things that we can do to improve the situation.
Thank you. We've got a question. It says, what advice would you give to couples who do not want to have children, or who are finished having children? So they've got like 6 children and say, no, sir, we don't want to. What are the most advisable long-term options of contraception?
Again, it's individual specific. Depends what you want to use. Your permanent options are obviously there if you're sure. But because the reversible options have a pretty similar efficacy, we tend to push those more, because obviously if you do something permanent, there's always the risk of regrets. I remember working with a consultant who they saw a woman who was adamant that she didn't want any more kids, so she got sterilized, and then her existing kids, I think they died in a house fire or something like that. So really extreme example. But say, had she had the coil, for example, and she then wanted to have more kids, then she could. Or sometimes relationships break up, the woman is then with a new partner wants to have kids. So if that's the situation, then things like the Mirena coil or the copper coil are kind of your best bets. If you're 120% sure that you definitely don't want to have anything, then by all means use one of the permanent options.
Okay. So one more question that was asked is also on contraceptive. So it says, I use a copper coil and this has affected my menstrual cycle. At times it takes me 35 to 40 days before my period begins. Is this normal?
No, copper coil doesn't contain any hormones, so it shouldn't be impacting your cycle at all. The way the copper coil works is that it causes an inflammatory reaction to happen within the lining of the womb, and that's what makes it unfavorable for implantation. But it doesn't have any impact on your length of cycle. It can make you have heavier periods just by nature of the way that it works, sometimes longer periods, but it shouldn't be impacting your cycle length. So that suggests that there's perhaps something else underlying. In which case it would be worth seeing your healthcare professional.
And then another question we have is, what is natural family planning and how effective is NFP as a contraception method?
Not very. You have to be really strict, really disciplined, know what you're doing. So natural family planning, as I mentioned, is where you don't use any external methods. Usually you do it all based on tracking your cycle, knowing when your fertile period is, knowing when you've ovulated, and avoiding your fertile window. Either avoiding it completely by abstaining completely, or by using additional contraception during that time, like condoms. So in terms of effectivity, if you're using it absolutely perfectly, apparently the effectiveness is 99%, but typical use, which is what people generally do, your success rates at avoiding pregnancy is 76%. So there's a 1 in 4 chance that you'll get pregnant.
So just to clarify, so NFP is when you look at your calendar and mark the days.
Yeah, and mark the days, yeah.
Okay, that should be painful.
Well, yeah, you have to be super disciplined. If you know you're not disciplined, it's not for you.
Yeah.
Yeah, that's true. That's true.
Do you have any more questions?
There's one more question here. There's a question from YouTube. This one is quite specific to this person. It says, my wife had a cyst which was drained on her ovary. Now she always has pain in that area. How come? And low drive, and how come here? He says, in low drive, we don't eat meat or take drugs. So they don't eat meat, or eat drugs, but she has that cyst. So how come it is painful?
Be difficult to answer that question. It depends on a number of factors, like the type of cyst and the size, the type of surgery she had. Probably the most common cause would be adhesions or scarring at the surgical site. That can cause chronic pain. She may also want to exclude a recurrence as well, although as a rule, cysts on their own don't cause pain. It's usually only if they twist on their blood supply, or if they bleed, or if they rupture, that they cause pain. So scarring is probably the best bet, but scarring is always a risk with any surgery.
Okay.
The question is, what is the best thing to use for morning sickness or nausea?
Nothing. Nothing works. It just sucks. But you can try. Ginger.
And fasting.
Yeah, you just have to grin and bear it and get through it, basically. Some women find that ginger helps, and there is evidence to suggest that it helps. I think the thing to remember with morning sickness is nothing is going to completely take it away. You are just going to have to put up with it, but there are some things that can make it a bit more bearable. So ginger sweets, ginger tea, chewing raw ginger root, that can be helpful. You can get motion sickness acupressure bands that you wear on your wrist. That can help as well. Eating little and often. Have something dry, like a dry cracker, a dry piece of toast before you even get out of bed in the morning. And avoid foods that are really high in sugar. Like sometimes you can get pregnancy cravings for like sweet things, fizzy drinks, crisps, chocolate, but that sort of thing isn't going to help you feel better, and it can make you feel worse. So those are the main things really. Crackers, toast, first thing in the morning before you get out of bed, like a dry digestive biscuit or something. Have small meals oftentimes throughout the day. Have what you fancy. Have bland food, because your smell is often really heightened, and spicy foods, things that have an overpowering smell, will make you feel worse. And yeah, ginger. Drink little and often as well. Drink as much water as you can as well, but don't have big amounts of everything, because that's more likely to make you sick. And then there's medications, of course, as well, which again will not completely take everything away. They can stop you vomiting, but they don't take away the nausea, unfortunately.
Thank you for that. We're kind of running out of time. But in terms of craving, for a man, if my wife is craving something, should I just press on and go and buy whatever she's craving?
Yeah, go and get it. She'll probably change her mind by the time you get home, but it's not.
And if you're craving something in the middle of the night,
yeah, go and get it.
Go get McDonald's.
I agree. You've got to try and get it. Remember, we said you need to look after and tender for your your one. So yes,
Amen.
to be fair, she's carrying the baby in the womb, having morning sickness, and you're just sitting there. So that's the little you can do to help. So yes, go out and get it.
That's good. Good. Thank you guys for that. I'm gonna invite Pastor Ramlin to come back and close for us.
Hey guys, thank you so much for your presentations, Dr. Guti and Dr. Picard. Thank you for your presentation on touching areas that maybe we haven't typically spoken about in a church on a Sabbath afternoon. But I think it's very important that our young, all our members, especially our young couples, are educated on these things. It's very informative, and it's good to talk about all the details that you clearly have gone into detail with today. So thank you very much. But it's refreshing that we can hear this from somebody within our faith community and share these things openly and have questions. So thank you those for Martin and Nyasha and Nigel and Chido for hosting as well. I think that all of the technical stuff that people have talked about today is fantastic, but I just want to end and say that children are amazing. So having babies can be amazing and is amazing. And so I hope if everyone who's watching this, those preferably who are ideally and in a marriage relationship or soon to be married, take the advice on board, and maybe there'll be an NEC baby boom in a few months' time. Time. Amen. So thank you once again. I believe the NEC young couples will be back in 2 weeks' time with another presentation. We'll announce that on our socials in the upcoming days and weeks. But I'd like to invite you to bow your heads for a word of prayer as we bring this session to a close. Father in heaven, Lord, we thank you for the privilege that we have to learn how the body works and how scientifically these things all play a part. Biologically, we pray, Lord, that you would bless those who have been watching and those who will watch afterwards. And I pray, Lord, that whatever area in our lives that we need to glean and pull this information to, that you would allow us to apply it where we need to. Thank you for the two doctors who've come on board today. Thank you for blessing them and allowing each one of them to use their skills and talents and education and experience to benefit our church community. We pray, Lord, that you would bless each one of us, bless the team who are coordinating these presentations, that you continue to guide them as they lead out. We pray in Jesus' name. Amen.
Amen.
All right, guys, thank you. Any closing words, Martin, for the next presentation? Or
yeah, the next presentation will be in 2 weeks. We are still working on it, but if there's any viewers who got suggestions, please let us know. Young couples who are married, any issues, please let us know, and we'll make sure that we cater to those needs.
Okay, thank you, everyone. On a switch of topic, our next presentation is on, hey, little man, is on Monday. We have a real talk session on Monday at 8 p.m. So thank you guys for tuning in. God bless you, and see you again